to our publication entitled Rural Appalachia Battling the Intersection of Two Crises, COVID-19 and Substance Use Disorders, a collaborative endeavor by the faculty at East Tennessee State University College of Public Health and the Center for Rural Health Research, as well as graduates from East Tennessee State University, Quinlan College of Medicine, and the Rural Primary Care Track. In the midst of the COVID-19 pandemic, rural Appalachia is at risk for previously unforeseen side effects from physical distancing needed to contain the virus, including increased mortality from substance use disorders. In 2015, drug overdose mortality rates in Appalachia were 65% higher than the national average, largely driven by opioid use. While rates had declined, drug overdose mortality rates in Appalachia remained 48% higher than the national average in 2018, the most recent year of data available. Since that time, early data from the CDC show rising drug overdose mortality rates nationally, and anecdotally, partners in Appalachia attribute these most recent trends to impacts from COVID-19.
And this is important because people living with substance use disorders are at increased risk for both exposure to and poor outcomes from COVID infection. They experience homelessness and incarceration at greater rates than the general population, which make physical distancing difficult or impossible and place individuals at increased risk for COVID-19 exposure and transmission. Other risks associated with substance use disorders include poverty, housing and food insecurity, lack of access to healthcare, and complex chronic conditions, all of which complicate proper screening and treatment for COVID-19. Further, the chronic use of high-dose opioids restricts breathing, which can lead to chronic respiratory disease, increasing the risk for COVID-19 morbidity and mortality.
Even as individuals are at high risk of overdose and COVID-19 mortality due to substance use disorders, access to treatment services has been disrupted, including the vitally important medically assisted treatment, or MAT, for opioid use disorder. MAT includes methadone, buprenorphine, and naltrexone. These substances are generally dispensed in person in the context of a biopsychosocial clinic visit. Due to social distancing measures, the federal government has relaxed restrictions, allowing providers to dispense 14 or 28-day prescriptions to patients who are deemed stable. Although these relaxed restrictions allow many patients with OUD to stay safely sheltered in place, some patients are still required to report to methadone clinics daily or buprenorphine clinics weekly to obtain their prescriptions. This requirement puts high-risk patients at greater risk of COVID exposure and transmission, or risk of relapse and overdose if they are not able to access MAT. The use of telehealth services for MAT has significantly increased, thereby allowing many patients to stay safely sheltered in place while continuing biopsychosocial treatment for addiction.
Programs like self-management and recovery training, or SMART Recovery, Alcoholics Anonymous, or AA, and Narcotics Anonymous, or NA, and other faith-based programs are key for patients in recovery. Many of these programs have shifted to virtual programming throughout the COVID-19 pandemic in order to promote community support for recovery. However, despite these new virtual opportunities, there is some concern that patients may have difficulty participating or having due to lack of access to reliable internet or phone services.
Additionally, syringe service programs, community-based programs that provide access to and disposal of sterile syringes and injection equipment, vaccination, testing for infectious diseases, and naloxone distribution have been negatively affected throughout the pandemic. Although considered essential public health services by CDC, one study found that 25% of syringe service programs have closed at least one site since the start of the pandemic. And finally, the economic impacts of COVID-19 must also be considered. Based on data from the Great Recession, which strongly correlated unemployment with suicide and drug overdose deaths, the Wellbeing Trust and the Robert Graham Center for Policy Studies in Family Medicine and Primary Care found that approximately 75,000 Americans could die due to drug or alcohol misuse or suicide as a result of COVID-19. This poses a significant concern due to the loss of work and local economic decline for rural Appalachian residents.
And so, as rural Appalachia combats the substance use crisis amidst the COVID-19 pandemic, we must really reflect on the geographic, economic, health, and social inequities within our region. It is vital that as we seek a national recovery that results in a stronger America, that we reimagine federal policies that really center the economic and public health of rural Appalachia.